Welcome to the MS Gym podcast, where we give you the tools to live life by design, not by diagnosis. I'm your host, Brooke Slick, and here we go. Hello, everyone. In this episode, I'll be speaking to renowned neurologist Dr. Mitzi Joi Williams of Atlanta, Georgia, regarding the increasingly popular mode of medical communication called telemedicine. At no other time in the history of medicine has this option to communicate with our healthcare professionals been more important. In addition to a behind-the-scenes look at telemedicine, we discuss the many advantages of this mode of communication and what we can expect in the future. This interview is number 3 of 4 from the MS Gym's Thrive Summit, previously only available to summit attendees. I'm excited to be able to share this exclusive information with all of you. Let's go. Welcome, everyone, to this segment of the MS Gym Thrive Summit, where today we're going to be talking about telemedicine with Dr. Mitzi Joi Williams, also known as Dr. Mitzi. She's a board-certified neurologist and fellowship-trained multiple sclerosis specialist. She's passionate about educating and empowering people affected by MS to understand the disease process and the goals of treatment. She's a sought-after consultant, speaker, researcher, and author. She has expertise in understanding MS in underserved and ethnic minority populations and collaborates with national and international committees to advocate for people living with MS. She's dedicated to raising awareness about the importance of research participation and encouraging diversity in clinical research. In her book, MS Made Simple, she explains basic concepts about MS, including what it does to the body, how it's diagnosed, and what you can expect over the course of the disease in a way that's down to earth and easy to understand. By the way, we'll be including links to that, so look for those. She discusses topics including MS in African Americans and the importance of research participation to help the large community of scientists, clinicians, patients, and support partners working toward finding a cure for the disease. As a speaker, she's considered a multiple sclerosis expert and diversity and inclusion thought leader. She offers engaging and informative talks about MS risk factors, symptoms and management, as well as specialized topics such as MS in the African American population. So, Dr. Mitzi, thank you so much. The depth and breadth of your work is vast. So the fact that we have you here today to talk about telemedicine, there are so many other things that we could talk about. You could educate us, but today it's telemedicine, and that was because you were brought to my attention by Coach Trevor, who's the head of the MS Gym, by his right-hand man, Ken Allen, who found you online, and immediately saw. I immediately went to your webpage and I thought, did she just get into telemedicine, because of the pandemic, which so many doctors are embracing now. And as soon as I started looking, I was like, oh, no. She's got it going on. She's, the website and just how you interact and how you offer telemedicine. I knew you'd been doing it for a while. So could you tell us, when did you get into telemedicine? Obviously, not just in the last few months.
Right. So it's very interesting. I happen to train in Augusta, Georgia. First, thank you for having me. I'm so excited to be here as a part of the MS Thrive Summit. So I'm glad to be able to speak with you and hopefully reach those who see this presentation or this interview. But I actually have been a part of telemedicine for quite some time. I was fortunate to train in Augusta, Georgia at the Medical College of Georgia. That was the name at that time. And right around the time that I did my training, I won't date myself, but just created this system called the REACH system. And so this was a platform that has now become a nationwide telemedicine platform that's used primarily for stroke and stroke assessment. So in neurology, traditionally, most of our telemedicine has been directed to looking at acute problems. Stroke was kind of the easiest because we have a medicine that has to be given within a certain time limit. So if we couldn't get to people in those small hospitals or those rural areas where there was no neurologist in the middle of the night, people would miss out on a potentially life-saving treatment because they would have to wait to get sent to another hospital. So I've been a part of the telemedicine or understanding about telemedicine for some time, and then practicing telemedicine for the past 8 to 10 years. Also primarily for acute problems in ERs and in places where they don't have local neurologists. But it has more recently become popular in trying to assess many of our outpatient specialties like multiple sclerosis. People may have to drive 4 or 5 hours to see us. So how can we see them maybe in the comfort of their own home for some of those visits where they may not need to drive 4 or 5 hours to see us just for a blood draw or just for a quick check-in about medication. So I've been doing it for quite some time, and I'm excited to now be doing it for my subspecialty, which is multiple sclerosis.
For anybody who, like, we're talking about telemedicine, what if somebody just popped on here and they're like, what the heck is telemedicine? What is telemedicine?
Yeah, so that's a great question. So telemedicine is a very broad category that includes several things. So it includes basically remote medicine, whether it is talking to someone on the telephone, which is a form of telemedicine, or whether it's doing video visits where someone can actually do a video chat and you can see a certain person and they can see you and we can do certain assessments that way. And even telemedicine in the form of you being actually in a hospital setting. So for that person where the nurses or the doctors call us, they may be having a stroke, they're in the emergency department, and there actually is machinery that we can use a camera, we can do certain assessments, they can see certain things, and they can see us and we can see them. So there are kind of certain levels to it, meaning from the most simple to the most involved, where you actually have other healthcare providers there to help the neurologist or the physician on the other end do different assessments and do different parts of the exam. So all of that encompasses telemedicine.
Awesome. I love it. I love technology.
Technology is great. Now, when it works, it's great. Now, sometimes it doesn't work and it's not so great, but when it works, it's great.
Exactly. I live in the middle of a former cornfield, and we have awful service. So the fact that I'm seeing you at all, of course, mine always has a little bit of a delay, but now
well, I can see you perfectly.
Oh, good. So telehealthcare, telemedicine, essentially the same thing, right? Yes, and a televisit, teleappointment, all the same thing.
Yes.
Who would you consider a perfect candidate for telemedicine?
So telemedicine, so someone I would consider a perfect candidate for telemedicine is number one, so ideally telephone visits are not the ideal form of telemedicine, okay? Because obviously we want to be able to see someone, we want to be able to speak to them, interact with them. And then there are actually a good many parts of our neurologic exam or other exams that we can do just by looking at someone on the video, depending on their level of ability, or if there's a family member there that can help us do certain parts of the assessment. So the ideal telemedicine visit would be one where there is a video component and an audio component. So we can hear you and we can see you. And there are a variety of different platforms where that can be used. There are some that can be done on the telephone. There's some that can be done on the computer. So either having access to a smartphone where you can click to a website, or having access to a desktop computer with internet would be kind of the ideal situation. In terms of the type of patient, certainly we would not want to do telemedicine for an appointment where we have to make some type of major decision, or where you're having a major problem. Like if you're having chest pain, like you need to go to the ER. Like we don't want to do a telemedicine visit for that. If you're having some type of relapse and you can't see out of one eye, you need to go to an emergency setting to be seen. But there are many people who are very stable, that we may be able to see via a telemedicine visit, maybe a yearly visit. There's not much going on. For some people, for medication checks, if there are certain medications that people are taking, for instance, controlled substances, they have to have visits every 3 months where we basically check in, make sure you're taking it. Those type of visits would probably be ideal to do via telemedicine. And then also, if someone has a medication check, like they started a new medication for their MS, and we just need to check in, see if they're having any side effects or something like that. Those would be kind of really good ways to use telemedicine so that people wouldn't have to travel so far for those routine kind of very quick visits.
Have you ever seen any first-time patients via telemedicine?
So yes, so I have. So since the pandemic has begun, we have been seeing some new patients via telemedicine because they need to be seen and assessed. Ideally, when seeing a new patient, it's very important for a neurologist to be able to do some type of exam. And although we can do quite a bit of the exam over the computer, there are some subtle things on exam that we just can't do, like we can't hit someone's reflexes
Right.
remotely with a
Right.
hammer. So ideally, we'd love to see new patients in person, but certainly during the pandemic, we've been seeing people via telemedicine. And now as our clinics are opening up, we are seeing some of those people in person in clinic just to make sure that we get a good exam documented for those folks. So it is possible, but maybe not necessarily the ideal situation.
Have you had any patients that you've seen during the pandemic, let's say like prior patients that you've been treating all along, who said to you during the pandemic, you know what, I'm never going back. I want to do telemedicine from here on.
So absolutely, it's very convenient, so there was a lot of concern that, patients would not be able to engage in some of the telemedicine platforms, that they would not have access. And there are some people who don't like being seen over the computer, but by and large, most of my patients have been very grateful that they haven't had to take the risk to come into the office or come, from their homes. And so it's been really nice to be able to do that quick visit, and they can go back to their day and don't have to worry about parking in the parking lot or finding their way down the elevator. So it's been really nice.
Now, I've spoken to a couple of other doctors who they're actually loving telemedicine, and they said that it's easier to keep your day organized.
It really is.
You think so?
Yeah, so absolutely, right? So I have two small ones. So it is very nice to be able to kind of plan my day and not have to worry about horrible Atlanta traffic keeping me tied up for an hour. I think the other thing that's very helpful is that people are very rarely late for their appointments. So people can be late for appointments for a variety of reasons, whether it's traffic, whether it's parking, or whether they just left too late. And so, if you're late for your telemedicine appointment, you're probably going to miss it. You're probably in the bed sleeping and over, and just missed it. So it really is helpful because you don't have to build in an extra 30, 45 minutes or hour of time to account and catch up if people are late for whatever reason. You could just really kind of keep your schedule going and be able to see people and interact and get your work done.
That's absolutely awesome. We answered just like 4 questions right in a row there. Insurance. Is a telemedicine visit billed any differently than an in-office visit?
So the answer is yes and no. So this has been really the big sticking point that has kept telemedicine from becoming as widely available as many providers would like it to be. So the big issue has been reimbursement. So because of COVID-19, because of the pandemic, there have been quite a few restrictions that have been loosened. So one of the major concerns has been the point of service. So for instance, I've always worked at a large MS referral center pretty much most of my career since I've specialized in MS. And so we have patients that drive from different states. So I'm in Georgia. We may have folks that come from South Carolina. We may have folks that come from Alabama. We may have people that come from North Carolina or Tennessee. Originally, the way the rules were set up, in order for you to see someone who lives in Tennessee and you're in Georgia, even if there are patients that's traveled to see you, traditionally you have to have a license in Tennessee. So the point of service is where the patient lives. So basically, to see your patient, you would have to have 5 or 6 different medical licenses if you're a referral center. I even had a lady who would fly to see me from Morocco, right? So I'm not going to be able to get a medical license in Morocco. So if I were to see those people via telemedicine, I'd have to have licenses and be able to practice in all those states, which has been a huge hindrance. And that has been relaxed significantly. And also, in terms of reimbursement, telemedicine visits are now being reimbursed, or at least during the, from March, April, and part of May, reimbursed at the same rates as a follow-up. So, the other difficulty is that you don't get very much money back, and again, if you get into a visit and it's a regular visit, a telemedicine visit could still be a 30, 45 minute or sometimes hour visit if there's a lot of education needed.
Right.
But you were getting like a fraction of what, would be reimbursed if that person came into the office. So it is billed for the video visits. The initial changes were that you could bill the same as you would an office visit. Telephone visits are a little bit separate. We could not at all bill for telephone visits. Even if we talked to somebody for 30 or 40 minutes, there was no reimbursement for that prior to COVID-19, but now there is some reimbursement for that. We will see as the states are opening back up if those changes will revert back to normal. There are many of us who are actively fighting for that not to happen, but certainly that could affect telemedicine in the future if the reimbursement is, if you get $10 for an hour-long telemedicine visit, it's not going to be worth it for a provider to do it.
I would love to see all of those restrictions loosened, and yeah.
Absolutely. So there are many associations, including our American Academy of Neurology and other large groups that are trying to ensure that we're able to continue providing this very valuable service for our patients once the pandemic calms down a little bit.
I can't imagine the patient population wouldn't demand it.
Yeah, absolutely.
Because
I think we should.
Even though, it's this calamitous thing that's happened, there are good things that have come out of it, and people have gotten used to, like, last 9 weeks, I've done nothing but grocery pickup, and I don't know if I'll step in Walmart ever again. These little things that I'm used to. And if they said tomorrow, oh, we're not doing that anymore, I'd be like, so that kind of thing. I'm hoping that for the patient and the doctor's sake that
exactly.
continues.
And I think the interesting thing about it is that there were things that people thought could not be done remotely that are doing very well remotely. So, it's a way of life now. And I think that we have to find that mix. We do need interaction with people, of course, in a safe environment. And as a doctor, we absolutely need to see people sometimes to actually do good exams on them. But I think that this is a model, and many of the other models that have been created to do things digitally and remotely, we need to keep doing those things because it's more convenient. And especially for people living with MS, some of whom may have some disability, it can be very difficult to get to the doctor, even if you don't have disability.
And it takes a lot of organizing with family members and who can drive, because I drive 2.5 hours. There have been times when I haven't been able to drive. So who's going to take me, who's going to take off, and sometimes depending on who's working, who might be too old to take you,
exactly.
Like, but I'm excited. I
am too. I'm very excited because we've been trying, the office, I used to work at a very large MS center here in Atlanta before I went out on my own. And, it was a struggle trying to figure out how to make it work. We used to have patients go to a doctor's office that was near their home, and we still had to see them at that doctor's office, and that doctor's office had to coordinate. And so I'm really hoping that we'll make some major changes that will make the level of care a lot easier for all of us.
What about, because as I'm coming up with questions for you today, I have MS, and I'm thinking about my appointments and I have an upcoming appointment in October, and if it's telemedicine, what will be done differently? And of course, I immediately think about, well, what about the tests where they, he says, oh, push on my hands, pull on this, let me push down on your legs, push up on your leg, those kind of things. Then there are the other ones where he said, follow my finger, that kind of thing, or tap your fingers, or do you have alternative screening tests?
Yeah, so for some things, yes, for some things, no. So we've been doing kind of remote neurologic exams for stroke for some time. And there actually have been a lot of meetings over the past several months with our Academy of Neurology, where they have been having meetings where we even talk about things like how to do a remote neurologic exam. We can't do everything like test your reflexes, but there are alternate ways to test strength. So instead of pushing down or having someone pull, you can have them hold their arms up for a certain amount of time. And that will kind of give you a kind of brief assessment of, what their level of strength is. And then things like follow your eyes eyes, like we can have you do that while we're looking at you on the camera and be able to look at your eyes. Cameras are very high definition, much better than, even 5 or 6 years ago. So much of the exam we're able to do. Sometimes we may need a family member to assist with some of the exam, especially if someone is unable to get up and walk around. But there are some workarounds where we can at least get some assessment of the neurologic exam, even if we're not able to get the complete exam. In terms of what to expect, I think the most important things are to prepare for your visit like you would prepare for any other visit, having your questions and concerns that need to be addressed. I think the other things that are a little more subtle is to kind of pay attention to your environment, right? You might not want to do your telemedicine visit in the bathroom, sit on the toilet, right? Sometimes paying attention to the types of clothes that we have on. I have some folks that kind of, may have a bra on, and I'm like, well, let's put on a shirt, kind of, you have to think about what you're wearing, make sure that you're decent. Sometimes the angle of the camera can be a little unflattering, focusing on certain parts of our body. So there are a couple things like that, making sure you're in a quiet room, maybe not with the TV going and the radio and 10 people talking in the background. So that kind of preparation is important. I think the good part, though, is that during most of the pandemic, especially if people are working, many of us have been on platforms like this, like Zoom and other platforms where we kind of have to do those things. But so we have to think about those things also when we're doing the doctor's appointment, because they can see whatever's behind you, and so we also need it to be a quiet place because we're talking about your health care and your health information. You wouldn't want to be out in the mall on speakerphone having the whole world listen to what we're going to do about your MS medication.
What about HIPAA?
Right. So that's why you have to be in a quiet room for most of us. So for instance, when I see my patients, I have a telehealth disclaimer that's in my note. And it asks things like, where's the patient located? Where am I located? And who's participating in the visit? So, if it's just that person and they're there by themselves, I put them. If it's that person plus a family member or a husband or a wife or a friend or a child who's there in the home with them, then I list everybody who was a part of that visit. But again, it's preparation, not being out in public when you do your visits, just like you would do if you did a Zoom call for work or for some other, event.
I would think that telemedicine would also provide the opportunity for multiple, and I don't mean like a whole room full of people, but typically, at least with me, I go with one other person and they don't even go back with me. But if there were times when I've been on drug studies where I would have them come back with me just to listen. So my husband the doctor might tell him what to expect and blah, blah, blah. But 9 times out of 10, I'm there by myself. But this would give patients who typically wouldn't be able to take somebody with them to an appointment to be part of that. So I think that's an advantage. You could have
absolutely an advantage.
All of your kids sitting there. They actually, for the first time ever, maybe get to hear exactly what it's like. Exactly, So
That's definitely a plus. And that's one of the reasons that I started telemedicine for my own practice once I went out on my own. And I do sometimes educational visits with my patients where we sit down with them and their spouse. For instance, family planning is a big topic, right? And so it's very difficult to do with just that one person there. The other person may have questions. So even when I see people in the office, I often encourage them to have their spouse on the telephone, so that they can ask questions. But it's even better if we can kind of look at each other face to face and they're able to have those questions answered and to hear that interaction and also hear the plan that we have for, my patients' MS care. So I think it's definitely a plus that family members who may be home or may be able to run over to the house are able to participate in these visits because it helps the overall care of the person living with MS to have other people involved.
Now, and I'm just thinking like right now, there's just 2 of us. Can you include more than one person on the call?
So it depends on the platform. So for instance, with a platform like Zoom, I have had patients. So it also depends on what the regulations will be as we begin to get hopefully a better control of the pandemic moving forward.
Right.
So right now, the initial restrictions the initial restrictions for telemedicine prior to the pandemic were you had to have access to a HIPAA compliant platform, which usually involves paying for that type of platform for
And
a
when you say
healthcare
platform,
team.
you mean software?
Software. So a lot of it is web-based. There are a bunch of different ones. So Zoom has a HIPAA compliant platform, but it's not the same as the ones that we use for meetings, right? So the ones that we use for meetings is not quite the same as the HIPAA compliant platform, which is much more expensive.
Yeah.
And then there are other platforms there, I won't name doc.c.me. Some actual hospital systems have a platform through their, electronic medical record, but HIPAA compliant, meaning there's certain encryption software so that information can't be leaked out. Nobody can really kind of log in and, bomb your meeting, so to speak.
Right.
And so once the restrictions were loosened for the pandemic, it became acceptable for healthcare providers to use any platform. So FaceTime, regular Zoom, Skype, things that we traditionally would not have used.
Right.
So for those platforms like Zoom, yes, you can have multiple people. So I've had a patient whose husband couldn't physically be there where she was, and so they kind of logged in and I talked to both of them. And there are other platforms where it's not as easy to do that. So most of the platforms are not as compatible with you having multiple people log in, for the reason that we want it to be secure.
Right.
But certainly some of those will be available. And I believe that over the coming months, there's more technology that will develop. So we will likely have platforms that are HIPAA compliant, aside from Zoom, where you can also have multiple people kind of dial in or log in.
I can't imagine they're not in the background just scrambling right now.
I'm sure.
Just scrambling to make it all work.
I'm sure they're coming.
I love it.
Yes.
Does a doctor or medical professional, let's say you have a nurse who's helping you as well, do you guys need to be certified in telemedicine, or just as long as you're a certified whatever your profession, you can do it?
So no, you don't need a certification for telemedicine. Telemedicine is really just an extension of the care we already provide. It's not really a new service. I think that certainly there are different organizations. I'm a member of the American Telehealth Association. There are different organizations that have information about kind of best practices for telehealth. At this point in time, most of your major medical societies are probably also going to have, different guidelines about the use of telehealth for your specialty, because obviously doing a neurologic exam is different from doing, a type of exam for a family practice physician, but there is not a special certification that you need, because it basically is just doing a visit. We're just doing it over the computer instead of doing it in person.
Cool. Okay. And I think we kind of covered this before, but for instance, I live in Pennsylvania. My neurologist, let's say 5 years from now, he retires. And I think, I really like that Dr. Mitzi. I want her to be my neurologist. Is that something you'll now be able to do? Or you're hoping as they move forward that they will keep those guidelines lax?
So that would be great. So it will be great to be able to see new patients in different parts, of the country. And so I think that we always have to strike a balance. So for instance, with my patients who I see here in Atlanta, if they live 4 or 5 hours away, I often recommend that they also have a local neurologist, right? Because if they need to get admitted to the hospital, I can't admit them to the hospital in, Texas. Versus I can admit people to the hospital here.
Right.
So I do believe that there will be some combination. I do believe that it's also important that people with MS have access to specialists. There are many general neurologists who do a great job of treating MS, but it can be overwhelming for us as specialists to keep up with all the literature. And certainly if we're doing general neurology and there are, many other things that we have to keep track of, it can be even more difficult. So I think that there will be a demand for people to kind of follow with their general neurologist in some cases, plus an MS specialist, or a general neurologist who has a large MS practice and an interest in MS. So that is the hope. The hope is that people will be able to access specialists to see and kind of help make treatment decisions for their MS. And if they can do that in person, great. But if we can do it remotely and they have someone locally that can also kind of be a partner in their care, I think that that's a great model to have moving forward.
And I suppose just thinking of it from the patient's point of view, logistically, insurance-wise, that could get a little sticky because I'm sure, I have UPMC insurance, which that's, a huge health system up here. And, you have a whole list of doctors that are within that group, and you have to stick within that. They'll cover if you go to outside of network, but it's a higher cost. So I would imagine you get into all kinds of things like that as well. But
so absolutely. So I think that, the kind of cost sharing and the pricing will, be something that definitely needs to be worked out. Even for many of my colleagues who are doing telemedicine, before we could figure out how to bill for it, many people were just kind of doing a flat fee for that. And then people would either try to submit to their insurance for reimbursement for out of network costs, or they would just pay that out of like their health savings account or pay it out of pocket. So I think there's still a lot of issues that need to be worked out where that's concerned. But certainly there are some models that have worked. If you think about any of your large referral centers, whether it is, my old center here in Atlanta or academic centers, there are people from all over the country that come to these specialty centers like Mayo Clinic or Cleveland Clinic, and they're able to be seen and assessed. So there is a way that it can be done. We just have to figure out a way that doesn't make the cost exorbitant to the people, dealing with the condition like multiple sclerosis, but also make sure that the providers are able to be reimbursed for their services.
Exactly. How do you handle prescriptions? Just, just like a regular visit, and then you just, fax in or electronically send it to the pharmacy of the patient?
Yeah, so most prescriptions can be sent electronically now. So, for every practice, most practices now have converted to electronic medical records.
Yeah.
And so we can send prescriptions, through the computer. There are some issues sometimes with controlled substances. But again, that's where there comes in kind of this collaboration between, the person who's doing telemedicine. If there's a person that's separate and they have a local person, sometimes a local person is easier for them to prescribe. But, a lot of times there are ways that we can work that out. And now in most states, controlled substances can also be prescribed electronically, which actually is the safest way to do it rather than giving people paper prescriptions because, it came directly from the doctor's office.
Right. Good point. What would you say are the top 3 advantages of telemedicine versus a regular in-office visit?
The top 3 advantages. So I would say, they both have their advantages. I would say several of the top advantages of telehealth or telemedicine visits are, number one, convenience to the patient. Because you don't have to travel far for your visit. You don't have to worry about parking. You don't have to worry about additional expenses. If you're going to a doctor's visit 4 hours away, you're probably gonna have to pay a lot in gas. You're gonna have to get something to eat on your way back. A lot of, kind of hidden costs that we don't take into account. So it definitely would be more cost effective. And then convenience. And then I think that you also would be able to have that dedicated time to spend with your physician, so when you come to an office, depending on if the schedule is running behind, sometimes the doctor may have a little more time, sometimes they may have a little less time. Generally, if we're kind of sitting there doing those telemedicine visits, we're really able to stick to our schedule and we're really able to spend the full amount of time allotted for your visit with you. So I think that those are kind of the 3 top advantages. We can spend that time with you because we're not running around trying to do labs here and do this here and, not running behind if someone else was running late for their appointment. It's more cost effective and then also convenient because you can do it right from your home.
And, I think especially right now, like last week I had something I had to call my primary care physician about, but I called because I thought I was going to have to get an x-ray. And I called first because I wanted to see if he could just if I had to come into the office or if he could just send an order over to the imaging facility. And in the back of my mind, it would have just made it easier. Plus, in the back of my mind, it's all about germs. It's all about, contagious, patients who could be contagious. So I suppose that would be another advantage as well. You're not going to catch anything because you're not in it. Because I mean, I go to Pittsburgh, it's a huge facility. I'm going through floors and floors and buildings and there's no avoiding germs. They're just
absolutely.
So
Absolutely.
that would be an advantage, at least right now.
Mm-hmm.
Or any time for that matter. There's always a flu season. There's always
there is. There are always germs floating around. So so that's definitely another convenience at this point in time, is that it decreases your exposure to other people who may be sick, whether it's with COVID-19 or any other type of respiratory illness.
Awesome. So to wrap things up, where do you see the future? What do you see in the future of telemedicine? Like in your perfect world, what would you like to see, and how would you like to see it fit in with your practice?
Mm-hmm. So I really believe that telemedicine is here to stay. There were a lot of restrictions. I believe that, the restrictions won't remain as loose as they are right now during the acute crisis of the COVID-19 pandemic. But I do believe that, there will be a broadening of our ability to access telemedicine and use it in our everyday practice. What I foresee in my perfect world in the future is during my regular clinic day, having a combination of in-person visits and telemedicine visits. So I'll have a 10 o'clock new patient that needs to come see me in the office, and then I'll have a medication check that I may need to do on the computer because that person doesn't necessarily need to travel into the office. Or I may have, a full in-person day, and then I may have a half day that's a telemedicine day. So I do believe that it will be a part of our everyday practice or our regular practice moving forward. And I am just hoping that many of the physicians who are advocating for it, such as myself, and many of the organizations are able to, come to some terms that make sense, for both the patients and for the physicians providing the service moving forward.
Wonderful. Absolutely wonderful. Dr. Mitzi, I cannot thank you enough for coming on today. You are the perfect person for this topic, and that's evident. I want everyone to know that your information will be, whether it's your book, your website, which I think pretty much has, you can book you for speaking engagements. It's all on there. So we're going to have links to all of that. And again, thank you so much for sharing with our community. This is a hot topic right now, and I'm hoping that it's commonplace moving forward. So.
I do too. And thank you so much for having me. And I'm excited to talk about a topic that is very near and dear to my heart and pretty much a great part of my everyday practice. So thank you so much.
Awesome. You have a wonderful rest of your day.
Absolutely. You too. Thank you.
For more information on the MS Gym, you can find them on Facebook, Instagram, or at themsgym.com. If you'd like to know what I've been up to lately, you can catch me at brookslick.com. We'll see you on the next episode.